is that there is lack of autonomy for practitioners who are employed in acute care settings. This view is widely held by private practice owners of all professions, not just physical therapy. Merriam-Webster defines autonomy as the quality or state of being self-governed, the right of self-government, moral independence. Robert Strantham defines professional autonomy as the ability to control the conditions of one's work, much more so than other workers can or are able to. To help further expand the definition, Friedson defines two types of professional autonomy. The first one is technical autonomy, which is the right to use discretion and judgment in the performance of work. Licensure, regulations, accreditation, standards of practice, and practice guidelines are all examples of how technical autonomy is regulated. Yes, regulated. Autonomy does not mean unfettered independence. The second type of autonomy that Friedson speaks of is socioeconomic autonomy, which is the ability of a worker to ascertain and allocate the economic resources necessary to do his or her work. This, in my opinion, is one of the primary reasons for the external perception of our lack of autonomy. Many believe that if one does not completely own or control the business decisions of practice, that they cannot practice professionally, i.e. autonomously. This is particularly difficult for our physician colleagues who have been acculturated into this model. The physician literature is rife with articles that make statements like, loss of managerial oversight equates to loss of autonomy. A salaried employee lacks control. Lack of control over business equals lack of control over practice. Many independent physicians, however, today are selling their practices to healthcare systems in order to be part of accountable care organizations so that they can maintain market presence. Yet, they lament their loss of autonomy because of their loss of control. If one were to fully examine the two types of professional autonomy, one would realize that complete autonomy is impossible, just like complete freedom and liberty are impossible. Stranson cites Friedson as stating that complete professional autonomy is an unstable position because an isolated, independent provider will ultimately lose socioeconomic autonomy. Jules Rothstein, in many editorials, chided our profession for chasing something that's totally elusive and quite frankly immature: total autonomy. Participants in the past summit informed us that our quest for autonomy communicates exclusiveness and isolation. I believe the time has come for our profession to accept adulthood and let go of things that do not have a role in or add value to our future. We need to cease our assertion of and our quest for autonomy. We have as much autonomy as any physician. As licensed healthcare practitioners, we have always had the obligation to be autonomous in our decisions about what is the right thing to do. In essence, we must first own the decisions of our practice first. Ownership of business is secondary. Chasing autonomy demonstrates our immaturity. Stephen Covey writes of the habits of highly effective people. He teaches us that when we're young, we are dependent on others to meet our needs. This could best describe our students in professional programs. As we grow older in adolescence and young adulthood, we strike out on our own to demonstrate our independence while still being dependent on those people who give us the resources that have allowed us to exercise that independence. This best describes the novice professional. As we mature, we recognize the complexities of life and realize that interdependence is the way that we need to go so we can best meet the global needs of those we serve or for those for whom we care. We can do this by claiming and exercising our authority. That describes a mature profession. Swisher et al. In their 2004 publication stated, although many physical therapists continue to rely on models of professionalism that emphasize autonomy, this approach is regarded by many sociologists as outdated. If a person accepts the premise that professional autonomy is the litmus test for professions, then physicians and other healthcare providers may be forced to accept the fact that they have been deprofessionalized. However, changes in the healthcare environment present opportunities for professionals to renegotiate their contract with society. Pellegrino, a medical ethicist, contends that deprofessionalization can only be countered by those who own the title professional. So, at the end of the day, what is the future of physical therapy practice in the acute care environment? I believe that it is robust, dynamic, evolving, challenging, and challenged. Because of our interdependence on members on healthcare teams, we have an opportunity to teach our colleagues that practice in other environments about the necessity of collaboration, coordination, participation, and yes, interdependence. Interdependence is not an abdication of autonomy, authority, or responsibility. Rather, it demonstrates our maturity as a profession. We have a unique opportunity to help educate our physician colleagues who fear the loss of autonomy about the exercise of professional authority and responsibility because of employment relationships. Every physical therapy has the autonomy that they have earned because autonomy is earned. It is not assumed. We have as much autonomy as any physician because we have claimed it by virtue of the way that we practice on a daily basis. One cannot lose their autonomy. They can only abdicate it. Physical therapists practicing today in acute care environments have the best potential to educate our intra- and interprofessional colleagues about what it truly means to practice as a professional. Our practice mandates collaboration, communication, and humility in order to achieve the best outcomes for our patients. Atul Gawande is a cardiothoracic surgeon at Brigham and Women's Hospital in Boston, and he advises his physician colleagues that it is in the best interest of their patients for them to stop practicing as lone cowboys and start practicing as members of pit crews. It's a wonderful analogy. Just imagine a future where the actions and behaviors of physical therapists in these environments sets the standards for other professionals. We have the opportunity to move away from aspirations about our professional identity and embrace a practice environment that stimulates others because of our inspirations. I witness it every day because of how I and others practice at the point of care. These inspirations can help inform our colleagues in other environments as the healthcare system undergoes dramatic changes. Oliver Wendell Holmes once said, "I don't give a fig." I don't know what a fig is, but he doesn't give a fig for simplicity on this side of complexity, but I would give my life for the simplicity on the other side of complexity. To inspire, gain, and claim the trust and respect of our colleagues on interdependent and interprofessional teams, we cannot settle for simple, unskilled practice. We must demonstrate and articulate our mastery of complexity to the point where there's no question about our value. What we do appears simple to others. For example, ambulation, exercise, function. Yet what they can't see is the complex critical thinking and clinical decision-making that advises every action that we take. The best advertisement for physical therapy in our unique environment is an intelligent conversation that influences the perception of our colleagues and peers. They may see the simplicity. We need to communicate the complexity. If we succeed, we will no longer hear disparaging remarks and our value will never again be questioned. Acuity, dynamic ambiguity, value, authority, interdependence. Perception. The bar has been raised because medical advances, society, and the environments of care needed it to happen. Our professional behavior, acceptance of authority and responsibility, and our intolerance of less than intelligent practice will inform all consumers at all levels that we are integral and indispensable members of these interprofessional teams in an evolving care environment. If we so choose, our value will be perceived as priceless. Thank you for this extraordinary honor.